Hello, my name is Dr. Hank Sloan. I'm a naturopathic physician and I am the president and the owner of the Genesis Center. We are a multidisciplined clinic that treats a lot of varying conditions with the most progressive treatments that have ever been known to date at this point. Working with autoimmune diseases, cancer treatments, and just general health care overall, trying to always find the root cause and the way that we can help people the greatest way without always having to give medications and band-aid symptoms. So our goal is to always find the best treatment for a patient to heal them as good as we possibly can. So we're going to talk about some stem cell research today. This clinic, the Genesis Center, has been certified by ADDISTEM for a year and a half to be able to perform a lipoaspiration for stem cell treatment for different reasons that people need stem cells for. The stem cells that we've been working with we use for orthopedic reasons, for degeneration in joints, for pain in the body, as well as for other chronic diseases that have been researched to be able to be helped with stem cells. Things like Parkinson's, diabetes, degenerative diseases of the nerves, autoimmune problems, COPD, things with the hearts, lungs. So there's a variety of things that stem cells can help. A little bit about stem cells. Stem cells are cells that are cells that don't exactly know what to become yet. The work that we do here are with mesenchymal stem cells. These are stem cells that we can retrieve from belly fat in the office doing a procedure that is you're awake the whole time, and there's very, very little, if any, pain involved with it. It's a very relaxed situation. So we do a very gentle lipoaspiration of fat from the belly, where stem cells are stored in fat because stem cells can't touch red blood cells because they become different things that they can become when they're around different things. So stem cells know to go find distressed tissue. So once we pull stem cells from the fat and process them here in the lab, and we take a blood draw from you as well and create a growth factor solution that are growth factors that grow everything in the human body. We combine the stem cells with these growth factors, and then we put them in a light source and photoactivate these molecules to make them very strong, very powerful, and very active. This procedure can be found on addistem.com in great detail. So for different treatments, we have to use these molecules in different ways. If it's someone that has a lot of pain, then we can inject them in joints and in tissues. For over 250 processes just through the blood itself last year. These are some of the worst conditions of arthritis and degeneration that you can think of. Like, these are people that are scheduled for knee replacements, ankle replacements, and different surgeries. Only one person last year actually had to go have the surgery that they needed out of a few hundred patients that we treated. So that's very successful. As far as the stem cell treatments, we've done over 40 full stem cell treatments in a year and a half, and every single patient that we've done this process on is so happy with the results that they'll be glad to speak with anybody that's interested in this process. So I have good testimonials with these. The patients that we treated with stem cells for diabetes problems have had great success. One of the first patients was actually my grandmother, who is on 3,000 milligrams of metformin a day, and within 5 months she had to throw her pills in the trash. According to her doctor, she doesn't have diabetes anymore, and her hemoglobin A1C level went from 9 down into 5.4 range, so returned to normal. During this process, her eyes actually corrected back a little bit, and her pain in her back and body has decreased by a great percentage, and she's 86 years old. One patient came to me with COPD that wanted a stem cell treatment because COPD is a horrible disease where you can't breathe well. So he failed to tell me that he has diabetes also. Just didn't come up. So in later talks after his stem cell treatment, he actually told me that his doctor said he doesn't have diabetes anymore as well. I'm giving you testimonials of our personal clinic, but the research online about stem cells and diabetes is very immense and very specific, so you don't have to listen to me and just these anecdotal reports I'm giving. There's many scientific evidence of diabetes type 1 and type 2 cures. Now, type 1 diabetes is typically called juvenile diabetes. It is actually an autoimmune diabetes, which is different than type 2 diabetes that we get later in life because we've been eating too much sugar and we have insulin resistance. Type 1 has actually been found also to be helped by stem cells. In the autoimmune disease part, stem cells have a corrective ability for autoimmune diseases. It kind of sets the immune cells back into a pattern where they're supposed to be, or it corrects an immune dysregulation and helps those to heal. In type 2, which is a little bit easier to be helped with stem cells, in both cases we still have to follow a diet. You can't just go back to eating the way you were that caused it in the first place, so we're going to fix things in the body and then you're going to destroy them again. So there are some lifestyle changes that need to happen too. But if a patient is on insulin and they still have high glucose and they're headed down a road where they're going to have wound healing problems and they're going to have problems with their glucose being so high that it causes more heart disease and more brain dementias and things like that, kidney failure, that if we could just get them off insulin and just on maybe metformin or some diet control, we're still having success using stem cell treatment for that. In type 1 diabetes, if we can be able to take them down off less insulin and under control, maybe into an oral medication, then we're still having success. So the way we administer the stem cells is to try to get the stem cells into the injury area as close as possible. So once we have these molecules prepared in our lab, then if we're dealing with a joint problem or degeneration, we put them in the joints, in the back, in the spine, around the nerve roots, around the discs. You can actually drop them in the eye for eye conditions. We can drop them in the ears for tympanic membrane issues, like for a child who had tubes and their tympanic membrane isn't healing well. We can help to resolve that. This is the most incredible technique for wound healing that's ever been found. But the goal is to try to get these molecules as close to their injury as possible. When we're dealing with things inside the body, the brain, and the organs, we put them in an IV bag and we drip them into a vein. A vein goes directly through the lungs, into the capillary beds, into the arteries, and they go throughout the whole body. So, as is explained by Addie Stem and by some of the professors that teach stem cell research, stem cells in the blood system are going to go try to find distress signals. So if you have a distressed pancreas cells, if you have distressed liver, if you have a distressed lung, if you have neurological distress, things you feel, pain is definitely sending distress signals, but also things you don't feel, things that you don't know that are going on in the body, like neurodegeneration. You don't feel your pancreas even though you have diabetes, but it's sending a distress signal for your body. So these molecules that we put in there, such a high amount all at one time, will go and try to attach to these molecules. And once they attach to the molecules,